A little bit about my drive for looking at agricultural safety and health, and it really stems from where I grew up. And I grew up on a farm, still participate in the family farm. We live on 25 acres in Leaf River. And my daughter has been actively involved in 4-H and FFA, and she is turning 21 this year, and she is still showing livestock. And when I combine my nursing background into agricultural safety and health, when we were at cattle shows or at 4-H activities, if someone was injured, my daughter would very voluntarily say, my mom's a nurse, so she can help you. So I used both ways to identify areas of opportunity using what I've learned in nursing education and looked at, is there the ability to apply it to agricultural safety and health in rural communities. So a lot of the pictures that you're going to see in the presentation are literally of my daughter in the years that we've worked with livestock and showing it very competitively at the local, state, and national levels. And what I did initially to determine if this was actually a problem is looked at the literature and the data. And what I was able to find is that many families, farm families, do not look at their livestock, their animals, as a means of injury. They treat that as, this is the life that I've chosen, this is the path that I've taken, and it's just part of the consequence of choosing to live that life. And if they were injured, it was just part of everyday occurrence in their professional world. When you looked at from a healthcare standpoint, many farm families do not go to their clinic, their provider. They don't go to the emergency room. They don't seek medical attention unless it's severe. They will take care of their injuries themselves at home unless it impedes their ability to do their work or there's a severe enough injury that requires medical attention. When you see injuries that are reported, again, they are severe enough to where now we can log them based on how they're coded from a medical bill. And what we found is fractures, sprains, strains, amputations that resulted in an infection that could have very easily been treated with an antibiotic if caught sooner, caused the biggest morbidity and mortality among these farm families. And it wasn't specific to a specific role in the family. It could have been the father, the mother, and even the children. We know through research that in farm families, children do take on responsibilities of driving tractors at a very young age, 8, 10, 12, and they're working with livestock at that age as well. So farm-related injuries are not specific to just the adult population. So through the research and the evidence of what I could find published, when you looked at just cattle-related injuries, it was the third leading cause of reported farm injuries in medical data. And it killed approximately 30 farmers a year, the actual cattle themselves. When you looked at, well, where are we at in prevention strategies? Where are we in preventing these injuries from occurring? And what is the outcome of whatever intervention they chose? And the glaring outcomes that I found was, A, the farming family doesn't prioritize safety. It is extremely expensive to have an agricultural facility that is 100% safe. It's hundreds of thousands of dollars. Many farm families have inherited their farm through generations, and they're working with old equipment. And to replace all that is extremely expensive, and there is no incentive to become 100% safe in buying new equipment. There's limited information out about cattle-related injuries where an intervention actually showed a positive outcome and decreased the incidence of injuries that occurred. And right now, there really is no sound educational resources that have proven a change in either behavior of cattle management practices that resulted in a decline of injuries. Agricultural safety and health is behind nursing education. In nursing education, we use simulation and create a simulated environment to where our students can learn in a safe place how to deliver safe care without injury to a particular patient. In health, agricultural safety and health, there isn't that opportunity currently. It's a pamphlet, it's a handout, and that's essentially what the educational pieces are. So the purpose of my study was to look to see what are the current livestock management practices of farm families in northern Illinois. And I looked at the specific county of Ogle County, because I grew up in Ogle County and I had the ability to know farm families that would be an active participant. I asked about the barriers to safe handling practices. What prevents them from being 100% safe? And what could be changed to change those behaviors? And then tying in the nursing component, I wanted to look at what we do in simulation and the simulated guidelines that nursing education uses. Could that transfer to agricultural safety and produce an outcome? So the design study, in order to get families to participate and look at generational change in behavior, it was required that in order to participate as a family, one of the children had to be enrolled in 4-H and had cattle as their 4-H project. And if they were willing to participate from there, what we did different in this study is we took the simulation experience to their farm. We did not make that farm family come to us. So when we simulated the injury, we were in their farm, we used their resources and decreased that feeling of pressure that they had to deliver. They didn't know what resources were going to be available. And we eliminated that anxiety of, I'm going to be observed. They could function in their own environment. So we did the pre-survey. So we consented the families that day. They completed the pre-survey as an independent person. And we did the simulation as a family. And then we did the debriefing and discussion about what had occurred during the simulation all in one day. And what I asked for was an hour of their time. And they were willing to participate with knowing that they didn't have to go anywhere and we were coming to them. And I only wanted an hour. So in the pre-survey results, what we identified is that many of the participants, so I had 14 participants in the pilot study. And what we found that in a 12-month period, the patients or our participants had at least 3 or more injuries in a given year. And then we looked at what type of injury they had that they could remember. Fortunately, we didn't have any reported severe injuries in a year in the families that we used, but that we did see that there were some opportunities with lacerations that required suturing. We looked at what type of body part was being injured. So if we're going to recommend designing a curriculum, we wanted to make sure that we knew specifically what part of the body was being injured, and then how could we design our simulations to meet the needs of future participants. One interesting piece that I want to note is because we recruited a requirement in the study, they had to be enrolled in the 4-H project. Somebody had to be in the 4-H project of showing cattle, is that we wanted to extract some of our data in our respondents were the behaviors of training their project and working with their project, was that an area of harm? Were people getting injured just trying to work with their 4-H project and getting it tamed to where they could lead it by a halter and take the animal out of its natural environment? And in doing so, we were able to identify that 26% of the injuries reported resulted in them trying to train their animal to where their 8-year-old could handle the animal independently. We also saw that grooming, so washing and bathing and the care that you do for your 4-H project was also a contributor in the number of injuries that were reported. In our case, the use of gates, anything that could pin the animal and the participant was also causing the major source of trauma. So they were putting themselves in a place where they could be injured. When we looked at just the 4-H project, so a large majority of my sample was children ranging 12 to 18, and 12 to 18 is considered 4-H age. And what we found was of those 8 participants, they said 42% of the injuries they surveyed came from taking care of their 4-H project. What was nice to see is that they stated that they tried to do a risk assessment before they started working with their project. Were they in a place where they could get away if the animal demonstrated aggressive behavior? And could they position themselves or set their facility up to where they wouldn't be in a corner if the animal got aggressive? The unfortunate piece there is that the 8 participants said 16% of my reported injuries required some form of first aid. So here's a picture of the actual simulation. This is the farm family that participated. My standardized patient, if you will, or the person injured, was a nursing student. So she was taught how to be the patient. And we completed all the simulations for all 4 families in one day. We just scheduled them, and she became the patient. So she knew how to be the patient. She knew what to ask, how to move, what not to move, and how she anticipated potential respondents in the actual simulation. So in the simulation, we gave them a little bit of a pre-brief discussion. So we set the stage that there's one of the children is working on their 4-H projects. No one's checked on them in the past hour. And a family member goes out to the barn to check on a family member, and they find the family member on the ground in the barn with a broken leg, with a compound fracture where the bone is sticking out. We wanted to make it obvious that they needed to call 911 and get emergent care. We didn't feel that they were in a place to define and make that decision. Is it emergent versus non-emergent? So we wanted to make it very obvious that they needed it. We set the stage for how long the simulation needed to occur based on time of arrival for EMS. So once the simulation was deemed it was starting, that simulation continued until the EMS would arrive. So we got the data from the local fire department to say at this address, how long would it take you to get there from a time a phone call was made? And that's how long the simulation continued. In the cases of doing the simulation, I was the 911 operator. So I literally would sit in my car, so I could not see what the family was doing because I didn't want to skew them and ask them things based on what I was visually seeing. And I would ask them, what do you see? Can you check a pulse? Do you have ice? Can you make me a splint? And would walk them through the process of what an actual 911 operator would do. And in my experience in working with this and being in my car, the number of trips that people were making back and forth to the house based on the questions that I would ask. Do you have ice? Yep, it's in the house. Do you have a bandage? Yes, it's in the house. So they would be running back and forth to get back to where the injured person was. In this particular case, the mom took the role as the leader, and she would send the kids back and forth to the house, and they were running back and forth. This particular family got extremely creative in the simulation. They were able to find boards laying around to make a splint. They used duct tape because they didn't have any gauze to tape the splint while they were waiting for EMS to arrive. They took just a standard bucket that they would use to provide water to the animal, tipped it over, and now they could elevate the extremity. So they were able to follow the commands that I gave as the 911 operator, but you could also assess the team dynamic of the families as they worked and executed these things. Once it was over, then we talked about what went well. What would you change? If you had to do it again, what steps would you do differently? And in the discussion, or I'll take a step back. When you look at these behaviors, so I had someone that was only there as the recorder of specific behaviors. And what we did was we based it off the nursing process. Could they assess? They all identified, all four families said this is something that requires 911. We're not going to drag the injured and try to move them. They kept them where they were at. They secured a safe place. They provided first aid. They were calm in relaying the information to the other family members, whoever was on the phone with me. They could describe to me what happened. They could provide me the descriptive information that I needed so I could give them further direction using your standard 911 protocols. When you looked at how they responded after it was over, it was a pretty warm day when we did it. It was kind of like today. So you had those runners going to get all the needed supplies. They were sweating by the time it was over because we gave them, you got to treat it like it's a true emergency. And the first thing out of the runner's mouth in all four families was, why do we not have a first aid kit where we need it? Why is it in the house? If somebody's going to get hurt, they're not going to get hurt in the house, they're going to get hurt out in the barn. Why don't we have one? And they were all in agreement that we needed it. They recognized how important it was to not break out and not listen to what was happening from what the 911 operator was telling, to hear that clear direction. We talked about cell phone use. We talked about if the 911 operator is giving you that clear direction of what to do, why not use speaker phone instead of just one person on the phone relaying all the information? If everybody could hear it, could you divide and conquer a little bit faster? Could you hear the direction? What if what the person heard on the phone from the 911 operator wasn't exactly what was instructed? They interpreted it differently, and now there's a delay in that care and that treatment. We talked about if you have a cell phone and everyone has their cell phone, why so many runners? Why wait for that runner to come back? Because if you are keeping going in your first aid care, you could just call that runner and say, I need this, I need bandages, I need ice, I need gauze and a Band-Aid. And instead, you had delays because people were running one piece of equipment at a time. But they also had confidence. So even the younger participants, the 12, 13, 14-year-old participants in the study said, if I get the direction of what I need to do, I can do it. And I can follow directions. So they felt that in an emergency, they could do it if they were directed appropriately. Then we looked at their engagement of safety and what is preventing them from being safe in their activities as a family. We tied all of that together and included the adults. And what we found is that the adults skewed the risk assessment outcomes. So 6 of the participants, that is all the adults, said there is no need to do a risk assessment. And it is the younger children, younger adult, that is saying we do need to do a risk assessment or this is going to continue to happen. We also looked at, is safety a part of their work? The adults said no. The young participants of 4-H said, yeah, it is, and it should be. And then just the basic safety that we take for granted. Do you check on each other and make sure everybody's doing okay? I haven't talked to Susie in over an hour and I haven't seen them. Maybe I should go check on them. Or everybody's in the house except for Tom. Where's Tom? And creating that check and balance if the family's doing particular tasks on the farm, that you can set your phone to an alarm so that you can check in with everybody and make sure that everybody responds in an appropriate time frame. The other component here is, can you identify aggressive animal behavior when that animal is showing it to you? They all said that it was important. But then when we had our debrief discussion about how important is aggressive cattle behavior in the work that you have to do to complete your day, it no longer became important because it still needed to get done. And just like in healthcare we are taught there are certain behaviors that patients show when they're showing aggression. They're frustrated. You're in their personal space. Animals do the exact same thing. Where is that being taught? Is it being taught at all, or is it trial and error? I was in a bad place, the animal got aggressive, and I got hurt. So at the end of the day, when we looked at all our outcomes and talked with the participants and looked at simulation, we said, yeah, it is a good tool. And using simulation in agricultural environment does increase awareness that things have to change. Where you need to change it in your curriculum design, you got to look at where the injuries are actually occurring and why. And one of our recommendations in this is, if your young adults of 4-H age are saying these things are important and you want to change generational behavior, you start with the younger generation, not the older generation, because they're too set in their ways. And if you encourage young people to step up and have the confidence to say, I don't think it's safe, would that contribute to changes in safety practices on the family farm? We also said you have to tie in those barriers to engagement and recognize that this is their occupation. This is what they do for a living. And if it means that they may get injured because that is part of their job, they will take the risk. And recognizing that that has to be part of your educational component. When I looked at education, because I've been in nursing education for the past 16 years, I'm looking at what are those outcomes and what do I want that education to be? We all know that working with students as educators, they want variety. They want hands-on. And in agricultural safety and health educational practices now, it is lecture-based. And where those lectures occur is in schools, is where they get some exposure to animal safety and agricultural safety, whether it be an FFA or through the extension office in the particular county that they reside. So when looking at these educational opportunities, what we said needed to be included in it is we have to teach how to conduct a risk assessment. And going to the family farm, using what they use to get their job done, and have them in conversation with the educator of, is this safe and is there a better way to do it? Is it changing a gate? Is it moving so you don't pin yourself in a pen that you could be trampled or pinned against the gate? And then looking at, what do you do if an injury actually occurs? And putting it all together. And looking at should you seek care? We all know in injuries that sometimes an injury may not be obvious right away. And in farm-related injuries, if those injuries aren't observed right away, they will continue to keep doing their work until they can't do their work anymore. And now you're behind. And calling EMS puts you even farther behind, especially when you're in a rural area. From a research perspective, this was a pilot study that looked at one county and 4 families. Taking a bigger picture, looking at all of Northern Illinois or all of Illinois, and looking at a larger sample. Is what's happening in Northern Illinois the same as what's happening in Central? Are we seeing the same type of injuries? Because in your curriculum design, you want to make sure that it can be used across the board. And then if we continue using simulation, we need to go back to the families that we've used simulation with to see if there's been any change in their behavior. There's a difference between telling me, yeah, I think we need a first aid kit. Yeah, we need to change the way we do our work, and let's move some of our equipment around so it's safer for us and safer for the animal. But did they do it after you left? Or did they revert back to old ways of doing it because it was faster and, in their belief, more efficient? So as far as dissemination, and what's exciting about this project that I had no idea when I did it, is that the use of simulation in ag safety and health, the nursing world looks at it extremely different than what the agricultural groups look at it. Agricultural groups think that this is the way to go, because now the focus is transitioning to, instead of going to the family farm, let's see if we can do virtual simulation. Can we, in a virtual world, put a family in a situation where they all have to work together, but now it's virtually? And from a research design standpoint, I can create in that virtual world and track their decision making of how they're actually physically doing the work start to finish. And I can research when decisions are being made and who's making them. Is it the parent? Is it the child? What are they doing? And then also can track the risk assessment in a virtual world. Are they moving things? Are they positioning themselves in a better place when they are participating in the simulation? The other component with this in the agricultural world is they have lots of non-English speaking workers, especially in like Wyoming and Nevada, Montana, where they're in very rural areas. And using simulation in a virtual world can teach them safe handling practices and we can put it in Spanish as a way to teach, and then they're actually hearing and getting the feedback and seeing where they're making errors before they actually have to do it in their job. From a nursing simulation point of view, they looked at it as, when we designed nursing simulation and had standards for simulation and ways to evaluate student performance or employee performance in a non-threatening environment, they had no idea what that meant when we presented this at their conference. Their initial thought when they asked us questions was, you took a high fidelity $100,000 mannequin out to the farm. And we're like, no, we used a standardized patient. It didn't cost us a dime, but our time and the gas to get us there, because we used the resources that the families had on their farm. And that was, it blew them out of the water. They didn't think about that, because in nursing, we're used to staging everything, and we want to see what our students do when we stage the environment. And in the use of simulation, how we did it, we didn't stage anything. We put them in their natural environment of their comfort zone and just watched them do their work. So what's been exciting is the conversations that we've had of how the use of simulation can grow beyond the nursing profession and be used in a different arena. And then looking at the agricultural side of, we can reach so many more people and so many more families by using more of a digital platform, virtual world, hands-on learning, incorporates all components of the family, because right now it's the kid coming home and saying, hey, this is what we learned in school today. And this way, that self-actualization of realizing maybe we do need to do something different. Maybe we need to think about the jobs that we're assigning our kids. Do we have a first aid kit readily available, and is it stacked with the things that we need in it? And how can we keep track of each other? So the next steps, as far as what the tentative plan in using this research and design, things that my committee, so Dr. Heidi Penny, she is the department chair for the nursing program. She was on my panel for my doctorate study. Her and I have been all over. We've been to Portland, North Carolina, and we've been asked to participate in podcasts for rural agricultural safety and health, and looking at participating in studies of larger universities that have an agricultural department, and looking at how we at Rock Valley College in Northern Illinois can be a leader in looking at how to design a platform in agricultural health that does not currently exist. And it's kind of exciting. When I completed my doctoral work, I literally thought this was the project that I needed so I could get my doctorate. And now it's transitioned into something that people outside of Rockford, Illinois, Leaf River, Illinois, find intriguing, interesting, and the ability to disseminate that is something that I did not anticipate, but it's something that I find is rewarding, having large universities wanting us to participate in changing the beliefs of education and agricultural safety and health. And I think that's puts us on the map, as well as with Rock Valley College, that they can be an active participant in making those changes in such a big area. And those are just a couple of the references that I used.